Hi, this is Dr. Taylor. We're going to talk about understanding your knee, right? So if your knee is hurting you, okay, number one, you got to know the anatomy. This is the femur, the tibia. So you can see here the femur and the tibia. Then, of course, you have the kneecap. Then you have the lateral meniscus here, and then the medial meniscus here, right on the inside of your knee. Coating all of the edges of your knee joint is cartilage. Keep in mind, this is your kneecap. It's rubbing on your knee when you bend it. There's cartilage there. So if you feel crackling in your kneecap area, that could mean that you have potential cartilage loss, potential softening of the cartilage, or a tracking issue. It's called patellofemoral tracking. Then you have the big joint of your knee where the femur meets the tibia. You can also have grinding in there too if you have a bone-on-bone knee, right? So you have to understand that though. The knee is made out of the femur, the tibia, the patella, the lateral meniscus, the cartilage, the medial meniscus, ligaments, ACL, PCL, MCL, LCL, all around, and then also the plical folds and the synovium and the Baker's region, which can become a Baker's cyst if it's swollen. So you have to understand that if you have meniscal tear or cartilage damage, okay, or arthritis in a bone-on-bone knee, or stage 3 arthritis or stage 2, or wear and tear, right? Number one, that all comes from the pressure on the knee. Pressure from accidents, pressure from daily life, pressure from being overweight. Number 2, poor circulation. So you're not moving enough, you're being stagnant. You're not eating healthy foods, you're not getting proper blood flow. There's a toxicity that's preventing blood from reaching the knee. The number 3, weakness, right? So not exercising enough, not getting on that exercise bike, not moving. Right? Not staying sedentary, a weakness. Pressure, poor circulation, and a weakness can cause this stuff to break down and get injured. What you have to do is you have to re-examine not only just your weight, okay? For every 1 pound you're overweight, that's 3 more pounds on your knee, okay? So if you're 10 pounds overweight, 30 pounds on your knee. If I'm 20 pounds overweight, that's 60 pounds on my knee. If I'm 30 pounds overweight, that's 90 pounds on my knee. So the weight needs to be examined. Number 2, the diet too, right? If you're not feeding good nutrients, right? MSM, glucosamine, turmeric, collagen, omega-3 fatty acids, antioxidants, all these things are good for the health of your knee. If you're not feeding yourself with any of that, then you're going to have a dietary nutritional issue. If you're eating gluten, sugar, dairy, alcohol, all those things will sabotage the health of your knee. If you're stressed out, that will cause extra inflammation. Number 2, if you're not getting any treatment, right? So you haven't gotten any treatment in your knees, never had laser, never had shockwave, never had physical therapy, never had chiropractic, never had acupuncture. If you're not doing any therapy at all, good therapy, accurate therapy, specific therapy with understanding, then it's no wonder why you haven't gotten better. Number 3, movement and footwear, okay? So exercise, you need to be exercising safely. Check in with us for our exercise video on how to exercise the knee, and then also footwear. If you're wearing flip-flops or high heels all day and your knees are killing you, it's no wonder why. You gotta get a good pair of shoes. New Balance, Hoka's, Brooks, right? Good footwear. This is Dr. Taylor with Understanding Your Knee.